There are many types of urinary incontinence, and today I'm going to talk about involuntary leakage of urine with any increase of abdominal pressure. When our pelvic floor muscles are weak, leakage can be caused by coughing, sneezing, laughing, or even quick exercise motions. Hi, Dr. Malka here, and today I'm going to show you the top 5 exercises to minimize urinary incontinence. Correct breathing and pelvic floor exercises can resolve most leakage. So we live in a society where we walk around with our stomach muscles tight so that we have flat abdominals, but then that creates issues of becoming shallow chest breathers. So we're going to begin just by starting and learning how to breathe correctly. So lying on your back, knees bent in a comfortable position, let's put one hand on the stomach and one hand on the chest. So breathe in through your nose, letting the stomach rise up, followed slightly by the chest. And then out with the chest, and then the stomach. And I'm going to do this with you a few times, and at first the stomach might feel tight, these abdominal muscles, because they are. So as we continue with this, you'll be able to see the abdominal area rise further and further with each breath. So again, take a deep breath in. And out. Breathing in through the nose. And out through the mouth. Breathing in. Filling the abdominal cavity. And then breathe out. Slow, controlled breaths. Breathe in. And continue with this. This is actually a really great way to relieve emotional stress as well. Breathing in. And breathing out. So let's incorporate the breathing now with tightening of the pelvic floor muscles. You're not going to be able to see this. It's very subtle, but I want you to practice now squeezing the urinary muscles as if you're going to stop urination, as well as clenching the anal muscles. So let's incorporate this into our breathing. So again, hand on the stomach and chest, breathe in. And then breathe out. And as we breathe out, I want you to tighten those urinary as well as the anal muscles and squeeze. And then relax, breathing in with the stomach. And then breathing out, tightening those urinary and anal muscles. And when you're doing this, make sure you're not bearing down or tightening. It's just a gentle squeezing motion. And then again, breathe in. And breathe out. Tightening the vaginal and the anal muscles. Pausing at the end. And you'll continue this for 30 seconds or a minute. Let's do it a couple more times. Breathing in with the stomach. And out with the mouth. And then tightening those vaginal and anal muscles on the way out. So now we're going to keep building on this. And I'm going to start doing some bridging exercises that's going to incorporate the gluteal muscles and more of these urinary muscles. So I'm going to have you breathe in again. Breathe in. And breathe out, tightening those urinary muscles and the anal muscles and coming up into a bridge with the breath on the out breath. And then breathe in, vertebra by vertebra. And then breathe out, tightening those urinary muscles as well as the anal muscles and coming up into a bridge. Once again, breathing in through the nose. And breathing out through the mouth, squeezing those urinary muscles and the anus and clenching the buttocks as well. And breathing in through the nose. Coming down vertebra by vertebra, the buttocks is the last to drop. And then breathing out, clenching the urinary muscles as well as the anus and pushing up into a bridge. And you can continue to repeat this for 5 minutes, breathing in. And breathing out, pushing out, squeezing the urinary muscles as well as the anus. And coming up into a bridge. And then coming down, breathing in. Now continuing on with alternate arm and legs. I'm doing this exercise because it mimics walking or running or a lot of exercises that you're going to go through. We're going to be at tabletop pose in yoga. We're not going to drop the pelvis. We're not going to round the back. Just nice and straight. Breathing in. And then breathing out. Reaching forward with the arm, back with the leg, and squeezing those urinary and anal muscles. And then breathe in, coming down. And then breathing out with the opposite arm and leg, making sure to gently squeeze those anal and urinary muscles. And breathe in. And breathe out. Tightening and creating really good pelvic floor balance. And then breathe in. And breathe out. And breathe in. And breathe out. While you're exercising, I want you to continue with these breathing exercises. So for instance, if you're coming down and you're doing a squat, when you're coming down, I want you to breathe in. And then as you're coming up into the motion, the exercising motion of the squat, I want you to breathe out, clenching the urinary muscles as well as the anal muscles. And this is true also if you're doing pull-ups or push-ups. You want to breathe out when you're releasing and in while you're pushing and doing that exercise. That's when I need you to tighten those urinary and anal muscles. So even while you're exercising, you're going to continue to do these motions to prevent urinary incontinence. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available
for any questions you have or suggestions for future videos.